Hey guys, so we're gonna go through another anatomy of pain video. In this video series, we'll be going over the most common causes of pain in different regions of the body. If you missed part one, where I did most common causes of pain in the shoulder, go ahead and check that out on the Instagram pages, or you can go to my YouTube channel and watch that video uninterrupted. Obviously, today we'll be going over the most common causes of lower back pain, as you guys can see here. So I've got selected and highlighted a couple of muscles already in the region of the lower back that I believe are mostly responsible for lower back pain. The first muscle that we're going to point out is in the category of muscles that flex the hip. So the hip flexors is a very popular term that a lot of people throw around as far as the reason for why low back pain exists. And I believe the muscle known as the psoas is the most common hip flexor that does cause lower back pain. And let me explain the reasons why. If I rotate the body upwards, you can see that this psoas muscle does originate, meaning it attaches from the front/side aspects of all five of your lower five spine vertebra, known as the lumbar spine. So you have lumbar spine number 5, 4, 3, 2, and then 1. This muscle does originate from all 5 lumbar spine vertebrae, as well as all of the intervertebral discs in between. Those are just kind of the soft, cushiony type of structures that cushion the vertebra from slamming into one another. We'll get into more of that in a second here. And then, if you look, it then crosses the hip joint right here, and then attaches to the inner upper portion of the upper leg bone known as the femur right here. Okay, so the act of hip flexion is when you bring your femur up closer to your torso, as in you trying to pull your knee towards your chest. That is the movement of hip flexion. So a couple of reasons for why this can get tight and cause pain. After long periods of sitting, the hip flexor, the psoas, can sit in its shortened position for a long period of time. And I like to tell my patients, you want to think of muscles almost like cement. If you keep cement moving, the cement stays fluid and doesn't dry out and doesn't stiffen. However, if you let the cement sit for a prolonged period of time, it's going to harden and stiffen. The muscles aren't really that simple. There are other reasons for, as far as why it tightens up. But really, that's how you want to think about it. If and when you keep a muscle at a certain length for a long period of time, it will start to assume that length even after you try to lengthen it out. So people who sit for long periods of time for work, in the car during traffic, often report back pain when they try to stand up. And here's the reason why. When this muscle stiffens into its shortened position, right, and you try to stand up and you try to elongate that muscle when it doesn't want to be elongated, it'll compress on the joints of the lumbar spine because the muscle crosses multiple joints, right? It crosses the joints between one vertebra and the next one down. And then it creates compression to the joints of the lumbar spine in the back of the body, located right here. For 1 second, let me just hide the left side multifidus. We're going to talk about that muscle in a second. So where one vertebra ends and another vertebra begins, where those two vertebrae meet is the joint between the two. And then this muscle, when it tightens, it'll compress on the joints located between those two vertebrae, creating a pain that you could be feeling when you stand up after a long period of sitting. Okay? So there are stretches, self-massage techniques that we can do, and I can show you on a further video that allow for this muscle to elongate and for the compression to those joints to go away, thereby relieving the pain that is associated with the chronic shortening of this muscle here. Okay, so stay tuned for that further video. For now, let's move on to another muscle that I think is really responsible for low back pain. And this muscle is located right here. So this muscle is called the quadratus lumborum. This muscle is, it attaches from the 12th rib, right here. Okay, and then it goes down, as you can see, then attaches to the pelvis, right, at the top of the pelvis here. Along the way, it also attaches to each lumbar spine vertebra here. Okay, now this muscle typically gets tight after long periods of being bent over, or if you're using it forcefully to go from a bent over position to a upright position. Okay, so a lot of people, say for example, people who spend a lot of time bent over, as in like gardeners, if you're doing a lot of work on the floor and you're shoveling stuff, a lot of construction workers, etc., spend a lot of time in this bent over position. Now, this muscle is really responsible for maintaining upright posture in the lumbar spine, but if you're bent over and you're overusing that muscle, then that muscle can definitely get tight. Another reason for why this muscle gets injured or tight is when you forcefully use it to stand upright from a bent over position. You can think of an example being a deadlift, right? If someone is doing a deadlift improperly, or if they're doing too much deadlifting, this muscle can get tight, strained, etc., and it can then compress on the lumbar spine again because it then attaches from one vertebra to the next, compressing the joints, just like how we talked about with that previous muscle in the psoas. So yeah, there are other things, there are multiple things that we can do to help lengthen and self-massage this muscle out. We'll go over that in a further video as well. But for now, let's go over what I think is the third most common reason for why people have low back pain. And this muscle is the multifidus, okay? Now, this muscle is shown here as one continuous muscle that goes up the spine from the pelvis. However, this is not the most accurate way to depict this muscle. This muscle actually exists in individual strands. It's a little bit more accurately depicted in the thoracic spine, so let me go over the thoracic spine. This muscle actually goes from one thoracic spine vertebra here at this little lateral outgrowth, or this outgrowth off to the side of the vertebra, and it goes up and attaches, let's see, to another vertebra at the spinous process, which is the outgrowth kind of coming straight backwards towards the screen here. Now, this muscle, like I said, is more or less in individual strands, and when you do something to the spine, whether it be hinge from the spine or you're only moving from one part of the spine versus moving the spine in more of a unit type of fashion, this muscle can get strained. And when this muscle gets strained, it no longer is able to support that portion of the spine, and a lot of like biomechanical faults occur, and then compression then happens at that portion of the spine. It gets a little bit more complicated than that, but that's for another video. Today, I just really wanted to point out the anatomy of the multifidus. So this muscle, again, there are certain things that you can do to stretch it. There are certain things you can do to do self-massage. We'll get into that in a further video. And I just wanted to shed some light on what are, I feel like, the most common causes of lower back pain. Okay. If you have any questions, leave a comment in the comments section. If you're on Instagram, go ahead and heart this. If you're on Instagram, go ahead and follow me. If you're watching this on YouTube, feel free to subscribe, like, comment with any questions that you may have. All right. But that wraps up today's Anatomy of Pain video. Hope you guys enjoyed it, and we'll talk to you soon.